Time now for Better Pets. Our Better Vet, Dr. Andrea Dennis, is here to talk about tooth care for your pet, and she has Daisy the dog here to demonstrate some good dental practices.
Aww. Doesn't she look beautiful on camera?
And this dog needs a home. No, I'm just kidding.
No. Her owners are like, what? No. Look at how, oh my gosh, all right, we're not going to touch her because she's working right now.
She is working, and Daisy has been actually on the show a few years back, and I just think she is one of the best dogs in the whole world.
I think her owners are the best owners in the world.
Yeah, the Mians
so
are
well-behaved.
fantastic. But she is technically what we call a registered therapy dog. So she is the kind of dog that can go and visit folks, and just make them feel better in different situations. But also she is just, she has several different issues too, but she is just, her parents take good care of her.
She's beautiful.
Yeah, you wouldn't know that there's anything that we have to watch. Actually, I'm sure they don't mind. She does have allergies. And allergies, we've talked about that on the show before, but they're maintained very nicely because they stay on top of it.
She is our supermodel today for teeth.
She is. Periodontal disease is really a common incidence that we see when people come to see us. And a lot of owners don't realize their cats and dogs have that periodontal disease.
Over 3 years old.
Yeah, if they're any dog or cat that's over 3 years old, 80% of them have some degree of periodontal disease. Now, there's all different grades, but that's where it's not just a joke when you go see your veterinarian and then, you say, oh, I know she's got bad breath, ha, 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 or, but because it really can lead to major medical problems. And that's why if we can sort of maintain them, that would be the best thing that we could, prevention is always key. And that is anywhere from, you can sometimes get severely, badly bleeding gums.
Okay,
that's
so
one of the things.
These are some of the problems.
Yeah, some of the problems, and then when your gums bleed, and they loosen up from the teeth, then you lose those teeth. So you get tooth loss, tooth root resorption, and then the thing that people don't realize, because you can't see it, is all that bacteria, and it goes into the bloodstream, and where does it lodge? It lodges in different major organs, like your heart, your kidneys is another common place, and liver disease. So it's not just about the teeth, it's really about the whole body.
Wow. And it's interesting because for humans, we know that gum disease can lead to heart disease as well, so I didn't realize it was the same for animals. How do we protect them?
The number one thing you can do at home is brushing their teeth. Go ahead.
My cat, I don't know.
Well, I mean, this is the little cat toothbrush, and it's probably too small for camera.
Okay.
But that you can just put on your finger, put a little toothpaste on it, and then rub your cat's gums. You can give it a try.
All right.
All right, do you want me to try it with Daisy?
Yeah, go ahead.
Okay.
Give it a try with Daisy.
Well, Daisy, the first thing we want to do, come on, Daisy, is that, look what I got for you. And she says, I like Scott and Renee. Okay, we'll put the little cap. First thing I do is just let her lick the toothbrush. Okay, we don't want to make a big deal out of it when you're first teaching your pet how to brush their teeth.
And it's edible, obviously.
Oh yes, this is
what
toothpaste.
Does it taste like?
Yeah, no, I got it. That's toothpaste for cats. It's called CET. And it's actually made for cats and dogs specifically because they do swallow it. So Colgate or Crest, you don't want to use a human toothpaste because they're going to go ahead and swallow that.
Okay.
All right, so what we want to do is I'm going to sort of stand up just a little bit because it's all about Daisy. And now her canines. Her canines are the ones that you're talking about, and you just want to go back and forth. And yet people say, well, her mouth doesn't stop moving. I can't brush their teeth. I'm like, yes, you can. And then, because their tongues are always going to move. But then you want to get back down there to the 4th premolars.
How often do you recommend doing this?
Daily brushing is recommended.
Daily.
I know. And then we're going to do the little incisors.
Cats and dogs, even your cats?
Yes,
every day. Look at, you got it on your finger. You could do this.
But to have those beautiful, beautiful teeth is just amazing. I mean, because Daisy is well over 3 years. I'm not going to reveal a girl's age on camera, but she's well over 3 years, and those teeth are gorgeous. And
they are beautiful. I mean, seriously.
Well, we maintain them too. She also has regular professional cleaning too, which we do at the animal hospital. So that's another thing. But going back to some of the things you can do at home, there is chews. You probably heard of different types of chews.
Yeah, I use greenies.
Yeah. The greenies are very good, and there is an organization called the Veterinary Oral Health Council, and if you go on their website, which is vohc.org, you can see the list of recommended and approved items that they back, and those are chews, greenies. There's even a special food that they have too that's recommended.
Why would teeth break?
the most common reason is bones. People, the number one reason is people that give their dogs bones. That's really a big cause for breakage.
Not like bones
from a pet
We're
store.
talking about meat bones.
Right.
Okay.
And then believe it or not, nyla bones. I see, and those are in the pet store. I see a lot of broken teeth in dogs, particularly from the nyla bones. And then another common one is the antlers. People tend to like the antlers, but again, this is what I see in my practice are the more common reasons.
We have about a minute. I know you want to talk about something important.
Yeah, you know, we talked about Daisy being a registered therapy dog. Now, she is not a service dog. Okay, service dogs are like the dogs that you see that are well trained for hearing loss,
PTSD.
Right, and even if they don't have their vision, those are the common reasons, and those are service dogs. And because people are now also, there's a group called comfort dogs, or dogs that are for emotional support, and people are abusing that emotional support category, both in certain situations or also like on the airlines. So the airlines is cracking down.
Yeah, they really are.
And again, because they don't want you to take a seat or a place for a pet that is really needed. And almost everybody will bring a dog on, not almost everybody, but a lot more. It's becoming problematic. Okay. So the airline, for a year, you have to make sure they're seen by a medical professional.
Okay. Well, thank you.
You're welcome.
Always a pleasure. And Daisy, thank you so much for being with us. You're just
She's
the belle
a
of the
good
ball.
girl. She was great.
Dr. Dennis is the owner of the Bloomfield Animal Hospital on Old Windsor Road in Bloomfield.
And you can check out her practice out online, BloomfieldAnimalHospitalCT.com. And on alternating Saturday afternoons from 2 to 3, she's talking to listeners and taking questions during Pet Talk on WTIC 1080 radio. So tune in for that if you can.